An EHCP stands for Education, Health and Care Plan. And what it does, it sets out the areas that a child or young person needs help with in school, and that's known as the special educational need. But it also sets out the support they may receive, for example, a one-to-one TA, and that's known as a special educational provision. An EHCP can last up until a child or young person is 25, and it's reviewed by the local authority once a year at an annual review. And what's important about an EHCP is that the needs and the support set out in the plan are legally binding on the local authority. An EHCP can be requested by a young person or a child's parents, a professional involved, the school, or if the young person has turned 16 themselves, if they can make that decision. If not, then the parents can request it. And what they're asking for is an education, health, care and needs assessment, which basically is looking at whether an EHCP should be made. And what will be asked is whether or not that child or young person may have some special educational needs and they may need provisions. So what's important to remember is that the threshold for getting that assessment for an EHCP is quite low. After a request for an EHCP is made, the local authority has 6 weeks to let the person who made the request know whether they are actually going to assess. The assessment process is pretty wide-ranging, and they'll get information from lots of people and professionals involved with the child and young person from the school. After 16 weeks from the initial request, the local authority has to make a decision about whether they're actually going to want to prepare an EHCP. And then once a draft has been made, the parents have the opportunity to respond to that draft and also set out which school they would prefer to be in the EHCP. And then after that, and within 20 weeks from the initial request, a final plan has to be made.